Everyone who has downturned corners of the mouth, pronounced jowls, and deep folds absolutely needs to watch this video to the end. I think many of you believe that it's just age or gravity, and that it's normal. But in reality, there are 3 non-obvious reasons that cause deep folds and downturned corners of the mouth. For some reason, no one talks about this on the internet. And now, in this video, I will tell you about the deeper reasons why this happens, and give you practical tips and exercises so you can work on it yourself. I'm about to tell you about the first non-obvious reason, but first, please like this video so that as many people as possible can see it. The first reason for the formation of deep folds around the mouth is related to the specifics of our anatomy. And if you look at this picture, what do you see? You see the subcutaneous fat tissue. Look at what's between the subcutaneous fat tissue. See these lines? These lines right here, do you see them? What are these? These are ligaments. So inside our face, there are ligaments. And the most interesting thing is, you see these fat pads, they form compartments. What does this lead to? This leads to the fat pads being separated from each other, and they have compartments, partitions. If you look at this picture, yes, look at the nasolabial fold. Here there's a ligament, a fold, a little partition, right? And it's exactly in this area that the skin is the most mobile and dynamic. So it's exactly where these partitions are that the skin creases more easily. Let's move on. If we look down from the corners of the mouth, there's a ligament going down. See? Right here. It also separates the fat pad that forms the jowls in this area from the chin fat pad. There's more movement in this fold than in other places. That's exactly why creases form there. Now look, if we fill these fat pads with fluid, imagine that these compartments start to fill up. It's like you're inflating a balloon, and it starts to expand. What will happen? So if these pads inflate, it leads to the fact that wherever there are ligaments, a crease automatically forms, because the subcutaneous fat starts to increase, right? And between the subcutaneous fat, there are septa, so these little pockets fill with fluid, and the crease becomes even more pronounced. Plus, constant movement eventually leads to the formation of deep creases. It might seem obvious, but it's actually swelling that really speeds up the appearance of all the folds and wrinkles on the face. That's why nasolabial folds and these drooping corners of the mouth get worse because of swelling. So the first thing you need to tackle is reducing facial puffiness. So if you wake up in the morning with puffiness, you need to address it in different ways. Adjust your diet, improve your sleep, reduce stress, and of course, work on releasing tension in your body to improve lymphatic drainage from your face. The next not so obvious reason is related to the anatomical structure of our muscles. There are many different muscles in the face, and it's the face that expresses a huge range of emotions and feelings. The thing is, different emotional states cause different muscle tensions. For example, people who are more often joyful and positive tend to tense the muscles that lift the facial tissues. If your general mood is more about dissatisfaction, sadness, or sorrow, this leads to more tension in the lower facial muscles. So if a person is constantly dissatisfied, these muscles pull the corners of the mouth downward, making the face look unhappy. And the most interesting thing, a not so obvious fact you probably didn't know, is that the muscles responsible for lifting the corners of the mouth and the muscles responsible for pulling the corners down actually work as antagonists. What does that mean? It means that when one muscle tenses, the other relaxes. In other words, it means that if you really are in a state of joy, happiness, and you smile often, then these muscles below, on the contrary, become more relaxed. That is, they give way and stretch. But if your general mood is more sad or gloomy, it relaxes the muscles under the cheekbone and tenses the muscles in the chin and lower jaw area. That's an interesting fact. And there's also one not so obvious thing. You might not show any emotion on your face at all. Your face might look like a poker face, right? At the same time, if you're experiencing some negative state inside, the command still goes to the brain, and the brain sends a signal to these muscles. So over time, these muscles start to spasm and shorten. So if your general mood is sad and gloomy, these muscles will be in a state of increased tension. The longer a muscle stays in a state of increased tension, the faster it contracts. And when it contracts, the corners of the mouth simply start to droop. The third reason why deep creases appear actually lies within our body. If you look at the body, all the muscles work in sync. They transmit tension from the feet all the way up to the top of the head. Muscles and fascia, all of this forms certain chains. And if you pull, for example, from the pelvis, meaning if there's tension in the pelvic area, that tension can be transmitted to the face, including the corners of the mouth. How does this work? Look, the mouth is right here, right? The muscle that pulls down the corner of the mouth is the platysma muscle. See? This facial tension is connected to our thoracoabdominal diaphragm. So, when we breathe using the thoraco-abdominal diaphragm through the crura of the diaphragm, the tension can also be transmitted to the iliopsoas muscles, to the fascia, to the abdominal fasciae, and to the lumbar muscles. And further, this can also be connected to tension in the pelvis and our pelvic diaphragm, and even to the hip joints, and then further down. Tension can be transmitted both from top to bottom and from bottom to top. If we're talking about the corners of the mouth, usually the tension goes from the bottom up. And here, we also need to keep in mind that there are many internal organs located here. So, this means the reproductive system and the large digestive system, right? And the heart, from which tension can also be transmitted through the system of muscles and fascia. If you have any problem in your abdomen, or if the thoraco-abdominal diaphragm is blocked, this leads to tension. So, all these muscle lines start to pull on the lower jaw and even the corner of the mouth, because the platysma muscle literally weaves all the way to the corners of the mouth. And it turns out that from the body, all this tension keeps pulling and pulling on the platysma, which results in those unattractive bands appearing. And many people work on these bands, doing massage and stretching, thinking that everything will get lifted. But in reality, it does get lifted, but only for a short time. Because if you don't address the deeper tensions, which play a big role, this just keeps pulling the face downward. The face starts to deform. It begins to sag because of the tension. For example, even women sometimes have surgeries like a C-section, which might seem like a harmless scar. But often, women come to see me and it's literally like a knot. Everything is being pulled toward that area. And their face looks sagged, with the corners of the mouth drooping like this. And they give massages. They do all sorts of things. But it doesn't help, because until you untie that knot, your face won't tighten up. That's why you need to work deeply and holistically with your body, right? And that's why seemingly harmless things like the corners of your mouth are actually connected to our muscle chains, to many different muscles. On my courses, you will lift your face and look 5 years younger. I'll leave a link to the channel in the description below this video. I almost forgot to mention, there's another not so obvious fact that's thousands of years old, and it comes from Chinese medicine. There's the stomach meridian. And this meridian is one of the longest meridians. And what's most interesting is that it passes right through the lips and right through the corners of the mouth. If you read the description of what Chinese medicine says, so if the flow of energy along this meridian is disrupted, it leads to problems with the entire digestive system. You can experience constipation, bloating, indigestion, loss of energy, and chronic fatigue. But what's even more interesting is that it's also described that the face starts to swell. The complexion can take on an earthy tone, puffiness appears, and the facial muscles become weak and flabby. And one of the signs of disrupted energy flow along the stomach meridian is drooping corners of the mouth. It's also mentioned that various depressive states, when a person can't digest certain life situations, are also connected to drooping corners of the mouth. So friends, just look at how fascinating our body is, and how many nuances there are that influence each other. Now, let's move on to the long-awaited exercise. Right now, I'm going to show you an effective exercise that will improve the situation here and now. Of course, as I mentioned, it's better to work holistically. That's what I teach. But for now, I'll show you one technique that will already make things better in the moment. You'll need a napkin or some kind of cloth. Why? Because if you try to grab it with your fingers, especially if you have oily skin, your fingers will slip and the effect will be less. That's why you should take a cloth or a napkin so you can grip the muscle. We're going to work with a muscle that pulls down the corner of the mouth. The muscle that pulls down the corner of the mouth. It attaches right at the corner of the mouth and pulls it down. You can even feel how it pulls. You can put your fingers on the corners of your mouth and start making a displeased face or pull the corners of your mouth down. And you'll notice that this muscle is actually pretty strong. It's strong, it's big, and it really pulls everything down there. Of course, it needs to be relaxed. How can you relax it? Let me show you a simple way. So you can grab it at the corner of your mouth and make a slightly displeased face. What do? You grab the corner of your mouth, pull it upward, and make a bit of a displeased face. And then you add a light vibration as well, 5 to 7 seconds. Then take a deep breath in and out, release, and then stretch this muscle. By the way, if you pull the corner of your mouth upward, don't worry, you won't stretch the skin. Because when you feel resistance, for example, you pull upward and feel resistance. The resistance you feel is mainly due to muscle tension. So if you just pull the corner of your mouth up, it's very difficult to stretch the skin, believe me. If you grab the corner of your mouth and pull it up, you're stretching the muscles that attach down here and up to the corner of your mouth. That is, between this bone that is, you stretch the muscles. Therefore, it is safe. Because sometimes people write to me saying, "Oh, I stretched my skin." No, you can only stretch your skin if you do it like this, right? If you handle your skin carelessly in different directions. If you grab only one edge and pull, you won't stretch the skin. On the contrary, you're stretching the muscles and fascia. So, you take a cloth or a napkin and grab the corner of your mouth, like this. I take it like this and lift it up. But so that my fingers don't slip, I use it. So I took it, grabbed the corner of my mouth, and move it upward. There you go, stretched it. So I do it like this. It gets stretched, and I start pulling this corner of the mouth down. So as I tense up, I can feel the muscle tightening. I've stretched this muscle. I tense it, feel the tension, and then start to vibrate. I inhale, and as I inhale, I focus on the tension, and exhale, and the tension is released. Now just compare one side of your face to the other. It will actually be harder to pull the corner of your mouth down on this side if you did the exercise well, and it will be easier to lift it up. Compare the left side and the right side. It will feel completely different. The sensations are totally different. If you relax the muscles here, you'll immediately notice that when the muscle below relaxes, these muscles become toned, because the antagonist muscles reflexively. This is neurophysiology. Work that way. So, the tone of these muscles increases, the little muscle here, while everything here relaxes. And on this side, for example, it actually becomes harder to lift upward. Now, write in the comments what you feel after working on one side. Do you feel that lightness? Do you feel that your cheeks have become more toned, and that everything here has become more relaxed? Please let me know. So, you do the same thing. Grab the corner of your mouth, pull it up, stretch it. Everything here has stretched out. I start to tense this muscle a little, pulling the corner of my mouth down, pulling it down. I felt how the muscle tenses up a bit, about 30%. And as soon as you feel the heaviness, the tension, start to do the vibration. Do the vibration. Then take a breath in and out, and relax. Now it's the same here and here. Awesome. Now my cheeks are more toned. And now you can polish it even more, enhance this effect. You know how? By what means? By toning the facial muscles, especially the zygomatic muscles. Many face fitness trainers and face builders show this. Actually, it's enough just to smile more often, right? A genuine smile. But what else can you do? You can press your lips under your teeth, like this, right? And feel it. Place your fingers on the corners of your mouth and kind of push upward, that is, lift your cheeks up. Just do it 10 to 12 times. So, you relax these muscles and give them a little bit of tone. A light toning effect, just enough to activate these muscles, will be enough for the lower muscles to get the signal to relax. This alone will give you an immediate effect. But again, as I said, you'll get the best results when you address swelling. And for that, you need to work with the skull, the neck, the blood vessels to improve drainage, as well as the diaphragms and internal organs. There are many different techniques and methods that will give you more holistic health and also help you work on those unpleasant wrinkles around the mouth. Be sure to like this video and subscribe to my channel so you don't miss new episodes. This was Dr. Alesh with you. See you next time.